Well, after they go home, what are some of their limitations, and how long do these limitations last for them?
The limitation, I try to keep them simple. You know, the more complicated you make it, the more difficult. Really, after spine surgery, what you find, and I learned this in Los Angeles in my spine fellowship, because we had all these patients with spine traumas and fractures that had to go home, and you learn what you can actually restrict and not. The biggest stress on a spine after a spine surgery is twisting and bending at the same time. We call that torquing. In other words, twisting this way and bending down is the biggest load on the spine. So the rules are you can sit and stand and walk all you want, as a rule. You can drive if you're not taking a lot of pain medicines, but no bending, no stooping, no lifting for 6 weeks. Sometimes 3 weeks, but most of the time 6 weeks, on rare occasions a little longer. So people who have clerical jobs, people who have desk jobs can go back when they feel like it. People that do strenuous work, it might be a while, depending on the surgery, particularly if it involves bending, lifting, or stooping.
Without the bending, is there physical therapy? Is that standard post-operative procedure?
Most of not always. It depends on the problem of the patient. If the patient has a physical job and I know that they're going to have some problems going back, we might start therapy as soon as 3 or 4 weeks post-operatively. Even continue it. You know, and therapy is not the same. As a patient's healing, the therapy increases as well. You don't apply the same physical therapy to somebody who's 2 months post-op as you would to somebody who's 3 weeks post-operatively. So sometimes what you get is little bits of graduated therapy. 3 or 4 visits at 3 or 4 weeks post-op, maybe 3 or 4 more visits at 8 weeks post-op, and nothing in between except a home program. But as a rule, most patients have some kind of therapy program, whether they received it in the hospital or after they go home. And that's part of one of the failed spine surgery things we talked about too, is that sometimes they just don't get enough post-operative rehab.